Of the coronavirus is, of course, on everybody's mind.
And we have reached out to people here in the Lehigh Valley to find out what their biggest concerns are as the virus spreads in eastern Pennsylvania.
That's right, and we also invited two infectious disease experts to our studio here tonight to answer those questions. Dr. Timothy Friel is with Lehigh Valley Health Network and Dr. Jahre with St. Luke's University Health Network.
Thank you for having us.
Thank you.
Indeed. Glad you are with us tonight. And in other words, these are two leading authorities on these subjects in our area from the two dominant health systems in the area. So we have got experts representing the big systems here tonight to answer our questions. Now, one of the things we're hearing, of course, is, among many, that this is all hyped. You know, there are thousands and thousands of cases overseas, and only in the dozens or maybe hundreds here, it seems kind of small. Is it being hyped?
I think you have to have a perspective on this, and the perspective is that this is serious, but it is not something that the public at this point in time needs to be overly alarmed about. There are a lot of things that are going on right now to help keep this at bay, and no, it hasn't created the same issues that it has overseas. And we have an influenza epidemic right now that is much more serious, actually, than this is.
Mm-hmm. But, as you were saying earlier, we're just seeing the start of this here.
We are.
Right? Which means it could slope up in what kind of fashion do you think, Dr. Friel?
I think that's a really, really important point. We are really at the beginning of this. This is the tip. And we don't have a crystal ball to help us understand or predict what's going to happen next. Our secret right now is to do everything that we can to prevent the impact of coronavirus in our communities and in our nation, and avoid some of the things that we've seen in countries that have been hit earlier, countries like China, like Italy, and some others. So we're really, really being aggressive with our measures that are being put in place to help reduce the risk of this virus spreading at such a rapid rate through our communities.
Right.
Now, of course, we're seeing colleges canceling semesters, at least in-person classes.
You bet.
Public schools shutting down, things like those measures. Do you think those are appropriate at this time, or are we going too far?
I think at this point in time, it depends on the area. If the area is having a large outbreak, and particularly community spread, then a lot of those measures are perfectly appropriate. In many other areas where that is not the case, then they're not appropriate at this time. But I think what we both need to stress is that this is a dynamic situation that is literally changing by the hour in some cases. And so whatever advice we're giving right now may well change by the morning.
All right. Well, let's
very much agree.
Yeah, okay. We caught up with some people downtown in Bethlehem today to find out what they were thinking, and let's get a couple of those questions. Let's start with a question from Zach Umstead.
When is this virus actually going to hit its peak? And also, after it does hit its peak, how long will it take until things start calming down?
Again, I think to go back to the point that we had tried to make a little bit earlier, we don't know how this is going to play out. So what happened in China, there was a very, very rapid escalation in the number of cases, and huge, significant impact on that country. Our job, and one of the things that you're going to hear in the news and in the media, is that from a societal perspective, we're trying to push down that curve or flatten the curve. Really, to prevent the peak number of illnesses that have been seen in other countries, and if that isn't possible, delay the rapid onset so it allows healthcare systems and the public health infrastructure better time to prepare and respond. The last thing we want to do is to encounter some of the similar problems that have been seen in China and Italy, where there was such a rapid and brisk uptake that hospitals were not prepared or ill-equipped to deal with the sheer numbers that were occurring at the same time.
So
there's a term for this. It's called mitigation, rather than containment. Containment means to keep it out altogether. We're beyond that point. Mitigation is to flatten it so that it doesn't have the same impact.
So buying time, essentially.
That's exactly, and that's where we are, and there are a lot of effective tools that we have to be able to allow us to do that. that.
The testing thing has really been a conundrum and a frustration to a lot of people. The other countries we hear are so far ahead on that. They've tested so many tens of thousands of people. What went wrong here?
Well, the main thing, and the CDC has acknowledged this, in the beginning, they were responsible for having this test. They didn't get it out into private industry quick enough, and they had some trouble with their controls, and so they had to pretty much start all over again. Whereas in other countries, when we were doing 5,000 tests, they were doing 250,000 tests. But I think the important thing that we both can agree on right now, that the blame game really is really not productive. And although the testing is helpful, it is not the kind of thing that would totally stop this in its tracks. The country that had the most tests was South Korea. And despite the testing, they had an unbelievable amount of rise in their cases. They had something like 7,000 or 8,000 cases for a population that is 1/6 the size of ours. So just keep that in mind, that testing helps, but it is not going to actually stop this epidemic at this point, or pandemic.
On a personal level, if I think I'm sick, and I've heard what the symptoms are, can I get a test?
You bet. So, as Jeff suggested, the testing problem is getting better in this country. There are tests that are now available. In the beginning, testing was really restricted to public health centers and the CDC, and now testing has been made available at commercial labs. So certainly you can get tested in the community. The things we want to emphasize, those who don't have symptoms don't need to be tested. And I think that's really, really important. We don't have an unlimited number of tests, so we do want to reserve our tests for those who are symptomatic, people who have developed symptoms consistent with coronavirus infection. So fever, cough, shortness of breath, those symptoms that are very, very common in respiratory viral syndromes.
And if the test is being done on you, until that test comes back, that you have to put yourself in quarantine. So again, it's not the kind of thing that you want to do when you have no symptoms. I think that's a vital point that Tim makes.
All right, let's see if we can get another quick question in from one of our viewers, this one from Rachel Douglas.
About the lifespan of the virus as a whole. I'm curious if it will take on the same time span in the U.S. as it did in China.
Is there any way of
The simple answer to that is we don't know. We've learned a lot from what's going on in other countries, but the reason why this is called the novel coronavirus is because we haven't had much experience with it. And it's well to remember that the world hasn't had much experience with it. It really dates back to mid-December. It's not even 3 months.
We've heard some alarming numbers even today on Capitol Hill. The attending physician of Congress telling the Senate 70 million to 150 million people might get sick. Could you give any credence to those numbers? Is it wildly high? Or?
Again, we don't know. The figures are all over the place. I think the important thing for the public to know is that more than 80% of people who get this illness are going to have either a minor or negligible disease. And I think that we need to constantly emphasize this. If you listen to some of the more strident voices, it almost sounds like it's going to wipe out society as we know it, and that's just not the case.
Good.
What if I could ask, I know a lot of people are concerned about elderly relatives, or if you live with somebody who has an underlying condition and you go out and you're interacting with people, is that something you need to be concerned about?
Very much so, and I think it's a really important point for us to emphasize. So none of us right now have immunity to coronavirus. This is a virus that we have not been in contact with as humans. So all of us are at risk. The issue is not just who's at risk, but what happens when those patients get infected. We know that certain groups, like the elderly, like those who have underlying diseases, chronic lung disease, heart disease, diabetes, et cetera, are more susceptible to more severe outcomes and more severe forms of the disease. So therefore, I think it's really important to provide extra layers of protection for them. And that's why these issues of social distancing, staying out of large crowds, avoiding the things that we might love to do, but at this time probably not prudent, more important for folks like our parents, like our grandparents, the people we know and love who are older. This is really a time for them to avoid, if at all possible, those contacts. And there's a lot of stuff that we can do to help keep them safe.
And it's also important to know, unlike influenza, this spares for the most part the young. So if you're talking about the under 20 age group, that is not the group that's been particularly affected at all.
I know the producer's going to get mad here because we're starting to push our time, but we know of a particular young person who's home from college and wants to go out and have a good time, but also has older folks at home. Got to think about that, right?
We do, and I think it's important. I have young kids, I have teens, I have a son who's in his 20s, and I think we have to talk to them too about responsibility. So it's not just them and putting themselves at risk for an illness that in large accounts will not likely be very severe, but it's also the potential impact when they bring back and expose older members of their family or family with underlying diseases or illness. That's where I think folks really do have to think and make some important choices.
And common sense should prevail.
Yeah, and you have on both of your institutions frequently answered question pages. I don't know if Kevin, if we had a chance to show those web links where people can go to lvhn.org and we can go to SLU. Help me out here with that.
SLUHN and LVHN.
There you go.
And it's important to know that both of our institutions are working together to keep our public safe.
Yeah,
very much. We're partners in protecting our community and protecting our patients.
All right.
Thank you so much.
Well, it doesn't look like this is going to go away anytime very soon. So
we're at the beginning.
We'll be talking to you again, I'm sure. So
Thanks for having us.
Thank you very much.
Appreciate it. Thanks.
And our coronavirus coverage will be continuing online, of course, at WFMZ.com. If you go to the big coronavirus page, or actually our homepage, there's a link to this page which has loads of information for you. So make sure you go and check that out. Latest on what's closed and what's open and so forth. We will be right back.